Late one winter afternoon in a hospital in Pennsylvania, an elderly patient suffering from dementia is nowhere to be found. Her chart reads, attempting to discontinue therapeutic interventions. Physical restraints had been ordered for the 88-year-old, but her nurse discontinued them, contradicting the care plan. At 7:55 a.m. the next morning, December 3rd, the body of the woman was discovered on the roof of the hospital, dead from hypothermia.
Physical restraints are actions to restrict patient activity, either directly or indirectly, by physical or mechanical means. Their intended purpose is to limit patient movement for treatment, examination, or protection of the patients or others. They can be wristlets, anklets, jackets, or vests. Mechanical or technical aids can also include raised bed rails, wheelchairs with trays, or restraint belts, even locked room doors or bed linens.
Reasons in favor of physical restraints include apprehension of the patient's safety and to prevent self-injury. Physically weak patients could fall, for example. Sometimes restraints are needed to promote the safety of staff members and other patients. Some patients may feel unsafe because they are afraid of restless or aggressive patients. Many times it is necessary to use physical restraint when the patient has a contagious infection to prevent its spread. Restraints can also prevent the disruption of a patient's therapy or care. Evidence-based nursing practice indicates restraint as a better way to feed restless patients, as the use of physical restraints was the only way to calm the patient down so they could eat.
The reasons against the use of physical restraints are many. Healthcare providers used physical restraints as a form of punishment to correct unwanted behavior. Furthermore, it has been suggested that the use of physical restraint is very stressful to the patient. Family members witnessing their loved ones being restrained is also an emotionally traumatic event. The use of physical restraint has also been associated with adverse psychological, physical, and social effects in patients after they leave the hospital, leading to aggressiveness in some patients. The use of physical restraints impairs the mobility of patients when restrained for extended periods of time. Despite research indicating the use of physical restraints as ineffective and hazardous and leading to injuries for the restrained person, they continue to be used. In one study, it was concluded physical restraints should be eliminated entirely as an intervention in older adults with dementia. It can cause acute functional decline, incontinence, pressure ulcers, and regressive behaviors in a short period of time. Perhaps that was what the nurse in Pennsylvania was thinking when the call for restraints in the care plan was ignored. There are many stakeholders in resolving the issue of proper patient care with the use of physical restraints. The patient and their family want proper quality of life and comfort. The hospital care providers want evidence-based practice for patient satisfaction. The hospital lawyers want limited liability. And the manufacturers of these physical restraints want to sell their product. With words like ineffective and hazardous, even the manufacturers of restraints have embraced the less is more mentality. In a message from the CEO on the website of one major restraint manufacturer, he recognizes and supports the importance of product education, offering custom-made posters to assist in restraint reduction programs, designed to provide a visual reminder of restraint alternatives to continually work towards the least restrictive.
The solution of eliminating physical restraints while maintaining the safety, care, and integrity of patients is found in restraint-free environments. Physical restraints can be reduced through the use of technical aids such as pillows and bedside mats. The use of restraints can also be reduced by enhancing the environment in which the nurses work, giving the staff the opportunity to use their creativity.